Good morning.
Well, hey there, Dr. Biebermeyer. What brings my favorite alumnus into the library today?
Well, Ms. Perry, I'm in a bit of a pickle and I'm wondering if you can help me. I have a patient in private practice who's asked me a question I just cannot answer. I've been in practice 32 years and I've never seen a case like this. I've always thought that I knew everything about anything. But believe it or not, I ain't as young as I used to be. You know, they're saying there are 3 signs of old age. The first is memory loss, and the other 2 I forget.
Well, it sounds like you need a case of evidence-based dentistry, Dr. B. It's all the rage.
You know, I keep hearing about this evidence-based dentistry malarkey from my younger associates. You think you can teach this old dog some new tricks? I hear you have some computers that can answer clinical questions and work like magic.
Well, I can certainly try and help. Just remember, Dr. B, age is a question of mind over matter. If you don't mind, then it really doesn't matter. We do have access to a lot of the latest research here, so if we put our 2 heads together, I'm sure we can come up with something to help.
Well, great. Let me tell you more about this patient then. Well, thank you, Ms. Perry. Let me tell you, Ms. Janie Jones came in. She's a 33-year-old Caucasian female. Janie's a high school girls soccer coach, and she loves to sip coffee through the day. She also enjoys Gatorade very much, she reported to me. Janie stated that she was a heavy smoker until about 1 year ago. Janie reports mild depression. It's fairly well controlled with fluoxetine hydrochloride 40 milligrams. She reports some xerostomia through her workday. Janie has a long-standing history of tooth sensitivity. She wonders whether it began when she was dealing with bulimia nervosa when she was a teenager. Janie has a couple of frank cavities in the occlusal surfaces of her lower molars. She inquires today, though, about tooth whitening because she's getting ready for her 15-year high school reunion. She wants to look her best, of course. Janie has a discount coupon for a mall kiosk which offers on-site whitening at an appealing cost to Janie. Janie wants the dentist's opinion. She wants my opinion as to whether mall whitening by a non-professional is safe and effective.
Okay, well, it sounds like we can certainly use evidence-based dentistry to help your patient. First thing we need to do is take your patient's concerns and create a clinical question. Now it's PICO time.
Well, that sounds great, Ms. Perry, but what is PICO?
PICO is just an acronym we use to help us construct a clinical question. You have a lot of detailed information about this patient, but let's just zero in on the most important aspects. P would be patient. Who is your patient?
Well, that's my patient who needs tooth whitening.
Okay, I would be the intervention that we want to investigate.
Well, that would be mall whitening.
Okay, C would be the comparison. What are you comparing mall whitening to?
To professional whitening in my dental office.
Okay, and what outcome are you looking for?
Well, I'm wondering, is it safe and effective?
All right, now, PICO. Can you construct that clinical question for me?
Well, let me see if I can do that. So, for a patient wanting tooth whitening, is non-professional versus professional whitening safe and effective?
That sounds great. That sounds like a clinical question I can work with.
Well, Ms. Perry, don't tell anybody, but sometimes I forget the exact definition of some of these words. Well, for example, xerostomia.
Okay, Dr. B, we have some great dictionary resources for you. We have a great reference source called StatRef. One of the StatRef books that we subscribe to is the Stedman's Medical Dictionary for the Dental Professional.
Well, that looks good. Show me a little bit more about this.
If we open the dictionary, all we have to do is type in the term we're looking for.
Well, you spell it just like I do. That looks good. Show this to me.
Here we go. Here's the result. Xerostomia, dryness of the mouth having a varied etiology resulting from diminished or arrested salivary secretion.
Well, that's helpful. I could probably use that in my office every day for various things. Okay, so now we formed our clinical question. What's next, Ms. Perry?
Now it's the fun part. Now it's time for us to do some digging and find some answers. The best place to get information on the latest research is a database called PubMed. PubMed stores much of the research that is conducted in healthcare, and the best thing about PubMed is that it's easily available on the internet and it's free to users. Dr. B, you have used the internet before, haven't you?
Well, yes, I do believe that it was Al Gore himself who taught me how to use that.
Great. So let's check it out. Now here we are in PubMed. We could just type terms in this search box like we do in Google, but I want to conduct a more effective search. So I'm going to use something called mesh terms.
Well, wait, let me ask you a question. A wise woman once told me not to believe everything I read on the internet. How can I trust these studies that I see in PubMed?
That's a great question, Dr. B. PubMed indexes all kinds of articles, and some of them are opinions, some are commentaries, and some are rigorous experiments, and some are something we call systematic reviews, which is a very high level of evidence. Sometimes these studies are sponsored by a company, so it's important to really look at the articles you assess to determine how reliable they are.
Well, that sounds good. So I have to assess the value of the articles. Show me a little bit more about PubMed and the mesh terms and so forth that you were mentioning.
All right. We have our clinical question. I'm going to look up some medical subject headings based on the terms in our clinical question. We want to find something about tooth bleaching, right?
That sounds right. That was our patient, Janie Jones.
So let's see if there is a mesh term, a medical subject heading on tooth bleaching.
There you go.
Yes, there is. I can check this. This is the mesh term we want, and I can add it into my search right here while I look for another term. One thing that Janie's concerned about is the safety of tooth bleaching. So let's look up that as a mesh term, the word safety. Ah, we found one. We can click this term, and also add it to our search over here. Now you see that PubMed will search for us tooth bleaching as a mesh term and safety as a mesh term. Why don't we stop there and go ahead and run the search to see what PubMed has to offer?
Well, that's good. Show me again, Ms. Perry, why are we doing all this?
To find the best evidence for your patient. We want to answer your clinical question of PICO.
Well, good. So for that patient wanting tooth whitening, is non-professional versus professional whitening safe and effective?
Right now, we just are finding information about tooth bleaching and the safety of it. From the search results, you can see we have 53 different articles. Now, in order to limit 53 down to a more manageable number, we can set limits. I told you before about the types of articles that are considered good high evidence. Things like randomized controlled trials. Somewhere in here, please. There it is. I told you before about the types of evidence. Randomized controlled trials are one very good level of evidence. So I'm going to try to restrict our search to just randomized controlled trials. That brought our level of results down to 22, which is a much more manageable level. Now, one other part of our PICO question talked about mall whitening, and I don't really think mall is going to be a mesh term, but we can add it in as a keyword.
Well, let's see what happens.
Just for grins, let's see what happens. Okay, we tried to find a randomized controlled trial of mall and safety and tooth bleaching, and guess what? There isn't a randomized controlled trial. But that's okay. We'll see if there is just something about mall and tooth bleaching. Let's take out the randomized control trial. We can remove the limits right here and run the search again. And voila, we did find something that talks about mall and tooth bleaching and safety.
Well, tell me a little bit about that study. Keep going. This is really interesting.
Let's see. This study was done in April of 2011, or it was published in April of 2011, which means it's very, very current. I see it's in the Dental Clinics of North America, which is a highly authoritative source. To find this article in full text, we do have access to it. We click this link. It opens up our electronic holdings, and we click on the database. There it is, Dental Clinics of North America. And we go down to the April 2011 issue and scroll until we find the article we need. Safety Controversies in Tooth Bleaching.
There it is. This would be something great to show my patient, Janie Jones. I wonder what the conclusions are.
Well, that's up to you, the dental professional, to read and assess that.
Well, that sounds good. So we formed a clinical question, and it seems like based on our findings, I would think that the clinical bottom line is that professional whitening is in fact safe and effective, and it looks to be safer than non-professional whitening. This is simply review literature. It's not a systematic review. It's not a meta-analysis. But I'm asking myself, do these results help me in caring for my patients? What's the quality of evidence?
Great. It all sounds so simple, doesn't it?
Well, let me think about this a moment and what I do in practice. It may not actually be so simple. You know, there are some interesting issues with this patient case. This literature points to this one answer, but perhaps there are some dilemmas, even some ethical issues. What about the differences in cost for Janie Jones? Professional versus non-professional whitening. I don't really know the cost in a mall, but I sure know what I charge in practice. And what about patients in general, access to care? Is it easier to access whitening in a mall kiosk or on a cruise or in a spa than in a professional dental office? In ethics, we often speak of justice as one of the tenets of ethics. Is it just that only some patients can afford professional whitening or access and others cannot? That's a hard one to answer. Is the dentist beneficent? That's another ethical tenet. Is the dentist beneficent in providing whitening to this patient? Does the whitening treatment benefit Janie Jones directly? Or would there be greater beneficence in first treating Janie's frank cavities in her lower molars? Does she need that more with her limited resources? Are there risks in whitening if a patient has a long-standing history of tooth sensitivity? This would relate to non-maleficence, or, as we often say, do no harm in terms of ethics. Does Janie or does each dental patient trust her dental professional? If not, why not, you wonder? Truth or veracity is another tenet of professional ethics. Does the dentist speak the truth in this situation or in each situation? Or do some dental professionals kind of stretch the truth to sell more dentistry? Certainly, whitening could be profitable. Lastly, what about Janie's autonomy? That is, should Janie be able to decide for herself? Should she be able to control what happens to her body? Or should the dentist decide for her? Is it helpful for the dentist to be able to efficiently provide best evidence via an online search using evidence-based dentistry?
Wow, Dr. B, I never realized all the things you really have to think of when you're treating a patient.
Well, that's right. And each patient is an individual. We try to adapt ethics to each situation. But it does seem to me that it's extremely helpful, as you've shown me today, Ms. Perry, to implement evidence-based dentistry. That is, number one, to convert information needs or problems into clinical questions so that they can be answered. Number two, for me to be able to conduct a computerized search with maximum efficiency for finding the best evidence, that is, with which to answer the clinical question. Number three, to be able to clinically appraise the evidence for its validity and usefulness, its clinical applicability. And four, to apply the results of the appraisal or evidence in clinical practice. And lastly, to then evaluate the process and my own performance. It looks to me like EBD can really help me in practice to filter through all the literature and to efficiently answer questions like those of Janie Jones. Thank you, Ms. Perry, for teaching this old dog some great new tricks.